Welcome to Friday's edition of COVID-19. The global daily tally has hit above 500,000 cases, with Europe witnessing an unsettling pace in transmissions. Here in Korea, the daily count has been hovering in the 100s for 3 straight days. We start the program now with the latest on the pandemic with our Kwon So-ah for Korea and across the world. So authorities here are reporting more than 100 infections yet again on this Friday.
Yes, yet again, over 100, although we do see a slight decline, but still not a sign for relief as of yet. So let's take a closer look at the figures today. 114 new infections were reported on Friday. With that, the total stands at 26,385. 463 people have lost their lives due to COVID-19 here in Korea. And a little less than 1,700 people are in quarantine, and over 24,200 people have made a full recovery with 59 new recoveries. Meanwhile, there are a little over 50 people still in serious or critical condition, although that number has been seeing a slight decrease compared to earlier weeks. Now, if you take a look at this graph now, for 3 consecutive days, we had numbers above 100, and for 5 days in this Friday to Friday span, the number was above 100. And now let's take a look at the domestic and imported cases. If we break it down, we see that cases from abroad were between the single digits and the mid-20s. And when it comes to domestic transmissions, for 5 days, they were either above 100 or slightly below 100, which is a concern here because under social distancing measures at level 1, cases should be actually below 50. And that is also why the government is planning to make a revision to the social distancing measures, so they might be upgraded or changed on Sunday. And now, if we take a look at our graph now, we have 48 cases in the capital, Seoul. So that is more than Gyeonggi-do province. Recently, we had much more cases in this province, and also a double-digit figure over in Daegu. Meanwhile, we have 21 cases which were categorized as overseas cases this Friday.
Right. Now, so tomorrow is Halloween, and I remember earlier in the week you talked about club owners, a number of club owners, that is, here in the capital city, doing their part to ensure possible breakouts, to ensure that they don't happen. What is the government planning to do to ensure, to clamp down, that is, on potential outbreaks?
Well, Sunny, health authorities are really on high alert this weekend, and civil servants will be designated during the night hours to make their rounds at high-risk entertainment facilities. And that goes for nightclubs, pubs, and bars. In fact, in the metropolitan region, the government plans to inspect over 150 major nightlife establishments, which are required to keep entry logs and also make sure that they do not have too many visitors at once, and also follow strict rules regarding operating hours. And officials warned of strong punishments in case of if they do not abide by such measures. And Sunny, as you mentioned, also some major clubs actually decided to not open during the Halloween weekend.
I see. Well, that is good to know. So meanwhile, Halloween celebrations come amid a grim milestone on the international front, I hear.
Right, Sunny. Over 500,000 cases were confirmed in the span of 24 hours. The highest since the COVID-19 pandemic broke out. And this is not the only record figure that we are seeing. Now, 250,000, around half of those cases on Wednesday, all broke out in Europe alone. And in Europe, in fact, the figures have been doubling over the past 2 weeks. And with that, according to data, Europe, North America, and Latin America account for roughly 66% of global infections and 76% fatalities. Now, let's take a look at the latest tallies now. As of noon Korea time, you already have over 571,000 new infections, so it's likely that we're going to see another record high, and that brings the total to 45.3 million and almost 1.2 million fatalities around the world. Now let's take a look at the major outbreaks across the world. 9.2 million in the US, which actually also saw a record high on Thursday at over 83,000. And as of Korea time here, the daily figure has already surpassed 92,000. And also a concern in many European countries, as I mentioned, the The UK also has tens of thousands of new cases on a daily basis, and the same goes for other countries on our next table. If we take a look at Italy, which has surpassed the 600,000 mark, and Germany also fast surges here. This is maybe over the weekend going to hit the 500,000 mark as well. And those are the updates I have for now. We do not have a government briefing on Friday afternoon, so I will be back on Monday. And back to you, Sunny.
Right, so thank you for that. Have a good weekend.
You too.
Right, elsewhere around the world, Africa has recorded almost 1.8 million COVID-19 cases with more than 42,000 fatalities. Compared to Europe, North America and Asia, Africa has seen far fewer infections. But observers believe the region may witness a resurgence as nations in the East, South and North have been noting rises despite the declines in Central and West Africa. For more, I have Benjamin Egbodo, a freelance journalist in Nigeria, live on the line. Welcome, Benjamin.
Oh, thank you very much. Thank you for having me on your show.
Right, Benjamin, do start by telling us a bit about the COVID-19 situation in Nigeria.
Okay, at the moment, 2 days ago, that is precisely on the 28th of October, 2020, the NCDC, that is the government body that is responsible for disease control in Nigeria, released an update. And the update, we have about 147 new COVID-19 cases, 179 discharged, and sadly, we have 4 dead. Cumulatively, we can say we have 62,371 confirmed cases. And out of this figure, we have 58,095 discharge cases. Compared to other advanced European countries and other Asian countries, the Nigerian fight for this COVID-19 is not too bad. It's not bad. Looking at the poor health facility, we are not doing badly.
I see. Benjamin, I understand there has been public frustration over the government's handling of the pandemic, as well as a bit of suspicion over the accuracy of COVID-19 statistics in the country. Could you tell us a bit more about this?
Yes, there's been a very large disconnect between the government and the people. For some time now, most people,
Benjamin, we're having a problem with the audio and cannot hear you. Could you speak up a little bit, please?
Okay. Okay, can you come up with the question again?
Yes, the question is about the public discontent with the government's handling of the pandemic.
Yes, seriously, there have been a very serious disconnect between and people. The people don't trust the government that much. So any figure that the government is bringing out, the people are seeing it as a mere speculations. People don't believe the government that much because of a cumulative aggregate of distrust between the government and the people, as I said earlier. So the people there is no trust between the government and the people.
I see. What efforts, Benjamin, are in place to contain the pandemic in Nigeria at the moment? How are testings there being conducted?
Okay, at the moment, the government is seriously trying. I can tell you that the government is seriously trying. There have been jingles on radio, on TV, online. Basically on television and on radio, the government is seriously trying. But as I still said earlier, okay, for example, in Nigeria, we have fewer test centers in Nigeria. Sorry, can you hear me well? Can you hear me?
Yes, Benjamin, we can hear you. Please do continue.
Okay. In Nigeria, we have very few testing centers, which is not too okay for a large population like Nigeria.
Benjamin, I'm afraid we can't hear you again. Could you please repeat that sentence? There was something wrong with the audio there, or the connection, the internet connection.
Okay, I'm just trying to say we have very few testing centers in Nigeria.
I see.
Compared to the large population Nigeria is the biggest and the largest African country. We are supposed to have more testing centers in different localities, but what we have is centralized centralized. These testing centers are centralized, which is militating against the fight for this COVID-19. If Nigeria government want to do more, I think decentralizing this testing center would be a very big boost to fighting this.
I see. Benjamin, is there a mask mandate in Nigeria for members of the public there? Okay, I believe we have lost connection with Benjamin for now. Right, I think we have lost connection with Benjamin over in Nigeria. Hopefully, if we do connect back with him, we will bring you back that interview. Right, up next instead, amid the safety sought against the pandemic, a broad attempt to secure it in society is underway here in the capital, Seoul. I have our Chon Song-cho up next with details. Hello, Song-cho.
Good afternoon, Sunny.
Right, Song-cho, I hear you are at a global forum that aims to ensure security.
Yes, I'm at COEX, where the 14th International Security Conference and Exhibition is currently taking place. It's a flagship security expo in Asia. So every year they present the latest technology innovations in security systems such as video surveillance, biometrics, alarm monitoring. But this year, it's a little bit different. It's a little bit special because they have a huge focus on COVID-19. Well, I mean, because of the pandemic, the way we perceive these security has drastically changed, right? I mean, we not only have to safeguard our premises from intruders, but also we have to talk about the novel coronavirus. So first of all, we have someone from the organizer who will tell us a few things about this exhibition. We have Mr. Moon Ga-yong here with us. Good afternoon.
Good afternoon.
All right, so holding this giant event in the middle of a pandemic must have been really difficult. And I'm sure you have put in a great deal of effort in ensuring this event is secure as possible. So how are you making sure no one gets infected from the virus during the event?
By the recommendation of the quarantine authority, we've set up 3 filters to this event. One is online pre-registration process, where we filter out basically general public. This event is not open to general public. Only the professionals who are actually working for this field are invited to this event. And second is the registration desk, where only the hand sanitizers and only those who went through the hand sanitizing process and body temperature checking process went through are given name tags. The name tags are with QR code, where the identity is checked. The third filter, then with the name tag, they come through this gate, where the QR code is checked, as well as the body temperature again, and with the facial masks. So we filter out people, we check people. Inside the venue, you'll find many body temperature checking devices as well as hand sanitizers. It's open for everyone to use.
All right, so these are all the efforts that they're putting in to make sure that symptomatic COVID-19 patients don't get into the event. Thank you so much for your answer.
Thank you.
Thank you. All right, so he just mentioned about these security gates, and this is what I'm going to show you first. So I'm sure you have seen this like in a lobby of a big office building. So what you usually do is you have a key card or you have a QR code and you tap it and it will let you in if you have already been registered into the system. But they've added a new feature this time, and that is none other than the thermal imaging camera. So if you are a temperature above a certain temperature, then you cannot get in. So let's see if I can get in and see my temperature. So I have this barcode right here. I'll scan it. All right, so apparently I'm 36.7 degrees Celsius, so I'm safe to get in. And now our camera operator is, all right, he is safe to pass through the gate as well. So here it is, the show floor. There is over 100 booths, all occupied by local security system companies. They have different technologies, solutions, and equipment on display. And you can see all these people giving presentations and explaining about their equipment and technologies. And this year's topic is said to be post-pandemic security. All right, so the security gates that we've just shown you just now is actually perfect for bigger facilities because they can make sure that a lot of people can pass through all at the same time. But what about a smaller facility like a cafe or a restaurant? Well, this one is perfect because, as you can see, it's smaller and it looks a lot simpler, right? So it also automatically checks your temperature, but what it does is that it has a face recognition feature in it, so it can tell whether the person is wearing a mask or not. So let's try out and see. Let's say that I'm not wearing a mask and trying to get into a facility. So see, it's telling me that I'm not wearing a mask, which is really bad at times like this. So I'll put back my mask on. And should I try out scanning my QR code as well? All right, so this one, I need my smartphone. And so this is my QR code. All right, so it's been recognized, which means because this system also keeps an entry log as well by collecting these QR codes from people as well. It's simple, easy, very sanitary because we don't have to touch anything from start to finish. All right, so these are just a couple of equipment that I've shown you, but there are all other technologies that will just blow your mind away. Technology and innovation are two key factors that have really underpinned South Korea's dramatic, remarkable economic rise over the past few decades. But what is South Korea also known for these days? The so-called K-quarantine, or disease prevention and control methods, right? So I think if South Korean companies take this crisis into an opportunity and by integrating their state-of-the-art technologies into security solutions, then they'll be able to take a giant step further once again. This has been Chun Sung-cho reporting live from COEX, and back to you, Sunny, in the studio.
All right, Sung-cho, thank you as always for that particular coverage. Right, up next, we reconnect to a freelance journalist over in Nigeria for more on the COVID-19 situation in that African nation. I have Benjamin Egbodo, a freelance journalist, like I said, live on the line from Nigeria. Hello again, Benjamin. Can you hear me now?
Yes, I can hear you. I can hear you.
Right, so Benjamin, we were talking about the situation in Nigeria. You talked about how you have more than 62,000 cases in Nigeria with more than 1,100 fatalities. I asked you about the testing centers, and you talked about the importance of having more such centers in the country to better contain the spread of the virus. Benjamin, my next question to you is about the public protests against police brutality, which have taken many Nigerians out to the streets in the absence of face masks and social distancing. Are you worried that such large-scale protests may perhaps fuel yet another outbreak in the country?
Let me start by saying Nigeria cannot withstand another outbreak of.
Right, I believe we have lost connection with Benjamin in Nigeria yet again.
I'm going to get done again. We can't handle it. So based on what happened, there have been a very long period of police brutality in Nigeria. So what happened last week was just a cumulative of what has been happening over the years. There has been a protest. It will be a very big threat. It is a big threat. You know, seeing people protesting without wearing masks, we can't just take another outbreak. We can't just take another.
Benjamin, I'm afraid we've lost. We can't hear you very well. Can you hear us? Benjamin, can you hear me?
Yes, I can hear you. I can hear you.
Right. Benjamin, one final question then. Generally speaking, have there been any tangible social changes in Nigeria among the people there, given the pandemic? Because I am aware that Nigeria's 200 million people live on less than $2 a day, despite the fact that Nigeria is Africa's largest oil producer.
Yeah, there have been a lot of social changes, coming from the COVID-19. A lot of people lost their job. A lot of people lost their job. So that has been a very serious change that has occurred coming out from the COVID-19. That, Nigeria is the headquarters of poverty in the world at the moment. So that is another social change. Like, for example, now people find it very difficult gaining something tangible to do coming out from the lockdown, and some cases shut down. In the banks, for example, you have a lot of, because the banks are trying to put out measures to curtail the spread of this virus. So there have been a lot of queues in the bank, a lot of queues outside. And I can tell you that for you to go to the bank, you spend hours. Not just the bank, any government establishment, you spend hours before getting what you want to do. So it has the social changes is seriously affecting the Nigerian and the Nigerians adversely. I can tell you. And one point is very important for me to state here, that wearing of masks, which is key to protecting or as a measure against this COVID-19. A lot of Nigerians don't wear masks. On the street of Nigeria, a lot of people don't wear masks. This is because of the distrust between the government and the people. They just believe that COVID-19 is not real. In some quarter, they believe that COVID-19 is not real. So they don't wear masks in Nigeria, most people.
I see. All right, Benjamin, thank you very much for making the time to join us live at this very early hour with your thoughts.
Thank you very much for having me.
Right, and to our viewers here and abroad, we do apologize for the disruption in connection with Nigeria.
금년 겨울이 코로나19의 백신 접종을 앞두고 거리두기로만 코로나19를 극복해야 할 두 번째이자 마지막 겨울일 것입니다.
그간의 경험과 노하우를 토대로 방역과 일상이 조화되는 보다 정밀한 방역 체계가 필요합니다.
The prolonged plight in light of the pandemic is taking both a psychological and physical toll on the public. Given this reality, authorities here are poised to announce revamped social distancing guidelines early next month that seek a more targeted approach to keeping people safe and the virus at bay. Now, for more on these efforts, I have Professor Tak Sang-Hoo from Seoul National University. Welcome, Professor Tak.
Pleasure to be here.
Right, it's been a while since we've seen you here. And I also have Dr. Alice Hyungyung-Tan from Miss Medi Women's Hospital. Pleasure to have you back, Dr. Tan.
Thank you for having me.
Professor Tak, Korea has been recording more than 100 cases of COVID-19 for 3 consecutive days. What are your thoughts on the current situation here in the country?
I wish I can tell you something positive. My children have been going to school almost every day, and I like it. I hope that to be continued. But as we are approaching to cold seasons, we maybe see more spikes. I compared the situation to a marathon where we almost passed the 30 kilometers mark and we have left about 10 or 12 kilometers. But we are exhausted and we don't know if we're going to make it, but we need to make it. As long as we continue, we don't slow down, we don't even stop running, we can make it. The problem is how exhausted we are is the question, and how far we are going to be able to continue this way is another question. And I think there are a lot of questions on the table we need to answer. That's how we see. As cold seasons are coming, people tend to gather up inside and hunker down and close the windows and close the doors to keep the heat inside. And I think that's why we are seeing more and more clusters, and we'll see more.
I see, unfortunately that is. Dr. Tan, a prolonged presence of social distancing measures here and abroad appears to have paved the path to a fresh set of challenges, including the one that Professor Tak has mentioned, the fatigue among members of the public. Would you care to elaborate more on these fresh set of challenges?
Right. So up until this point, I think we've sort of been in crisis mode. We've had tunnel vision and we've sort of been racing toward our collective survival. But as Professor Tak just said, the race that we're running, we've realized, is not a 100-meter sprint. It is a marathon. And I'm not sure that we're even halfway through, because as we're noticing throughout the world, we may not have even peaked in terms of COVID activity. So we had a forum held by the government October 27th to sort of take a step back, look at where we've been and where we're going with COVID-19. And one of the factors that was discussed was sort of the collateral damage that social distancing has been causing, the fatigue, but also specifically damage to the economic sector, to education, and also to mental health. In terms of the economic sector, when we talk about just averages, it can be a little bit deceiving, because there have been segments of the economic sector, such as biotech or telecommunications or consumer electronics. They've actually done quite well during the pandemic. But small and medium-sized businesses, enterprises, they have really suffered a lot. And within the small and medium-sized businesses, especially women and then part-time workers, workers who are on short-term contracts, and low-income earners, they have especially bared a large burden in terms of the loss of jobs and loss of income. So they really do need to be supported more. In terms of education, there was a lot of enthusiasm about opening schools more, expanding schools more, because online learning and the digital divide have really heightened the disparities in terms of quality of education within the socioeconomic classes. It has also exposed children to being home alone, unsupervised, and that of course has led to some dangerous consequences that we've seen. And also in terms of education, women are, again, they are under more burden, because they are having to deal with the conflict every day of, do I go to work or do I leave children at home? And so that's another area that we need to concentrate. Finally, in terms of mental health. So one of the psychiatrists at the forum said that we have to take a two-pronged approach. One is sort of the what's happening in the general public. So he says he's noticed people who are more anxious. They are describing more depressed mood, and they're actually angrier now than they have been, say, compared to before the pandemic. And that's what's going on in the general public. The other approach is paying special attention to the groups that are most vulnerable to true depression and increased suicide risk. And those are actually the frontline healthcare workers who are actually dealing with a post-traumatic stress disorder kind of situation because of all the trauma that they've had to endure over the last 9 months. Also people who have underlying mental disorders, and people who have an inability to reach the resources or access the resources and the support that they need. They are at particularly high vulnerable risk for suicide and for depression. And so we need to take this two-pronged approach. These are some of the deficiencies of social distancing that we need to deal with in society.
Right. And now for more on the psychological repercussions of the pandemic, I have Professor Michael Bernstein from Brown University live on the line. Hello, Professor Bernstein.
Hi, thanks for having me.
Professor, perhaps we can start with details about your research and its findings with regard to the psychological toll of the pandemic.
Sure. So there have been a number of studies on this over the past few months. And I should clarify here that I'm really talking about other studies, not so much work that I've done personally. But the general story is that it's not looking good. So there was a report from the Centers of Disease Control in the United States, which showed that mental health has gotten considerably worse since the pandemic began. In late June, when new COVID cases were increasing around the world and the US was beginning to surge, at that point, compared to 2019, anxiety disorders tripled and depression quadrupled, both of which had prevalence rates of around 25%. On top of that, 13% of people from the study said that they either started or increased their substance use to cope with stress from the pandemic. And about 1 in 10 people reported seriously considering suicide in the past month. One topic that pertains to this, which my colleagues and I were interested in, is social isolation and loneliness. I think you may have shown the paper on the screen there. This is with Leron Rosenkrantz at MIT and Chris Hemmond at the University of Massachusetts. The findings are somewhat mixed, but in certain high-risk groups, it looks like loneliness is increasing. And interestingly enough, even Google searches for loneliness also increased after the lockdowns were imposed, which I believe was the case across several different countries, so not just specifically a result of the US or, for that matter, any one nation.
I see. Professor, does your study also touch upon the long-term health repercussions of social isolation amid calls for social distancing?
Yeah, well, there are serious risk factors. And so the paper that you, I think, brought up was sort of a bit of a summary of some other studies that have done. So we didn't necessarily do the original work ourselves. But what we're seeing from these other reports is that social isolation, and I should be careful on the terms here, that refers to the frequency of social contact, and loneliness, which has to do with subjective feelings of wanting more social connection. Each of these are strongly associated with mortality. And the importance of social connection really is deeply ingrained. So, for instance, one study found that the same part of your brain that's activated by the sight of food after fasting is also activated by social cues after being isolated. And there's something else that's worth considering here. While the research has not been done specifically with the virus that causes COVID, some studies have shown that things like chronic stress or loneliness are associated with weaker immune functioning. And that can make it harder to fight respiratory viruses. At the same time, social engagement can boost the immune system. So while physical distancing, or the more extreme version of sheltering in place, is necessary for containing COVID, there's a chance it could also paradoxically weaken immune functioning. But having contact with people remotely, we should mention, is a great way to maintain distancing while hopefully mitigating the effects of social isolation.
I see. Professor, what implications does your study have on efforts to ensure public health in light of this pandemic?
Well, like I mentioned, we're seeing higher rates of psychological disorders. So we need to work on developing interventions to offset some of the burden that people are feeling from COVID. And that's definitely a place where public health could play quite a large role. Also, I want to mention that one silver lining of the pandemic is that it's now common for people to have teletherapy or telemedicine sessions. So COVID actually presents us with the opportunity to study how we can best implement online healthcare. The reason that's so important is it may ultimately improve access for people with fewer resources who would have a hard time getting to in-person sessions. And now instead, they have the ability to access these resources online. And that could be a huge benefit down the road. Also, along those lines, classes like yoga or mindfulness are being moved online. And some people may find these valuable, especially as we move into the winter months where the opportunities for outdoor gatherings are going to diminish.
Right, Professor. All right, Professor, thank you for being with us with your thoughts at this very late hour.
Thanks so much for having me. Appreciate it.
Right. Now, I suppose social distancing measures should also seek to ensure a sense of collective response to this grave situation, which is easier said than done, given the fact that this is an unprecedented plight. Now, Dr. Dan, here in Korea, social distancing guidelines are divided into 3 levels, with 1 being the most lenient and 3 being the most stringent set of containment measures. What do you believe was the rationale behind the 3-tier system?
Well, we needed a flexible system that could move between levels based on the activity of COVID-19. How active was it? How many cases were we having? The three most important factors in determining the levels were the epidemic and healthcare capacity. In other words, were we able to absorb all of the positive cases per day? Were we able to track and trace all of the cases per day? The second is related to the pattern of spread. In other words, are we seeing a large amount of community spread, or are they very isolated clusters that can be very easily or more easily addressed? And then the last thing that we considered was the impact that social distancing would have on society as a whole. And are there possible alternatives to increasing the intensity of social distancing? So those were the three criteria that we looked at in terms of making our decision which level to be at.
Right. Professor Tak, despite the three-tier system, though, officials in recent days chose to implement a hybrid approach, I believe, including a level 1.5 and a level 2.5. Some claim this reality proves that the three-tier system was not properly thought out. What are your thoughts on this?
When it is a 2.5 level, then it's not full-fledged level 3. It's 2.5, under 3. What it means is that it applies to a different sector at a different level. And I think it reflects how painstakingly the government is taking this issue seriously. When I see the way of enhancing this social distancing as a way of suppressing the social interaction at a different level in different sector. And when this kind of harsh measure is applied to all the sectors universally, and there's always pushback. I think when you see, when you press one spot of a balloon, and there's another spot is popping out. Some people call it a balloon effect. And I think government is well aware of this situation. And now they're taking different approach. The problem is when they apply a different social measure, different intervention measures, social distancing measures, they need to have enough information about their boundaries and their jurisdictions and their geographical characteristics, and even the characteristics of the population. And they're still working to get a full grasp of what kind of population and subgroups they're dealing with. So I think it is a reasonable approach. It's natural, but it has a lot of homework to do.
Right. Dr. Dan, which is why come this Sunday, that will be the 1st of November, government officials are poised to announce a revamped social distancing guidelines. Keeping that in mind, what would be your words of advice amid efforts to revise the current social distancing levels?
Well, I think we need to keep 5 terms in mind. First is sustainability. As we said, we're in a marathon. This is not going to end anytime soon. So whatever measures we have in terms of social distancing, they need to be sustainable. The next is they need to be balanced. So we need to balance between how open our society is, how closed society is, but an overall balanced approach. Next, it needs to be risk adaptive. Because there's certain organizations, facilities that are high risk and others that are lower risk. And so we don't have to apply a blunt or overwhelming measures to all sectors of society. Next, we need to be resource efficient. Resources are limited, and that is a reality. Money is limited, that's a reality. And so we need to think about how best we can use our resources. Next is whatever we decide, it has to be socially acceptable. So going forward, we need to make sure that we have consensus, that the public is on board, that they understand our levels, and they agree and they follow. The levels, they need to be targeted, they need to be flexible. We need to work on maximizing infection control while minimizing social distance collateral damage. And so those are the things that I would think about.
Right. What would you like to add to that, Professor Tak? Your words of advice for revamped or revised social distancing guidelines?
Well, instead of talking about what kind of levels, how many levels we need, I think we need to talk about and think about what is the philosophy of this intervention measures in this whole response. what are we trying to achieve? And when we deal with this coronavirus infection, are we missing out something? And I think, we often say we are doing this. We are implementing these harsh measures just to protect our public, to prevent this virus from spreading. But there may be something that's affecting our society as a whole, and we may be missing out some of the suicide cases, some of the mental health issues as well. And when we think about the protection of the society, I think we need to look at all the different aspects, not just the virus and the health aspect alone. So I think it's time to think about how we can minimize the whole impact, not just the health impact, but also societal impact, and so we can continue going this way.
Right. Dr. Dan, there are also calls for the need, of course, like you mentioned, to tackle fatigue associated with the pandemic. And this is also because the Global Health Body believes that such public fatigue with regard to the pandemic may actually reduce public participation in containment efforts. What are your thoughts on this, or how can we tackle this potential problem?
Right. I think we need to think about, first, a shared decision-making approach to our policies going forward. And then the second is just having better communication about what we need to do. So a shared decision-making approach means that we need to engage the public in the decision-making process about what we're going to do. And that involves letting people know honestly, what are the issues, what's the risk, what's at stake, and what are our options. Instead of doing just a top-down approach, having the public engage from the beginning in terms of the debate and the deliberation about what's right for our society, that will engender a team-like approach, and people will be, I think, more motivated to follow whatever guidelines we come up with. The second is better communication. So I think we've had good communication so far. It's been trustworthy, it's been timely, but I think perhaps what we can do better is think about how we can target the message to different demographic audiences. And that could be used by using social influencers. So if we want to address, say, the young population, adolescents, and maybe K-pop stars are the best people rather than older politicians. Whereas if we want to address, an older public, actors who are in that age group might be better social influencers. We need to make sure we're making use of all the platforms available to do our communication as well. And then I think modeling good or social distancing behavior, infectious disease prevention and control, modeling in the advertisement that's going on TV, and everybody loves K-dramas, right? So perhaps that can be a subtle way of giving hints to the public of what we should do, is if we have that incorporated into our entertainment that we're showing the public, people can take clues from what they see on the screen and think, oh, this is normal, this is what I need to do in my life, and it can be part of our daily living, which is ultimately what we want. We don't want this to be something difficult that we need to really try hard at. We want to make these infectious disease prevention and control habits part of our daily life.
Right, and such efforts, of course, would also prevent complacency within members of the public. Professor Tak, authorities have also vowed a tailored approach to stemming the virus by conducting extensive testings and preventive measures in certain regions that they would choose or they would select as being particularly risky. What are your thoughts on such efforts?
Perhaps what we need is more of a surgical intervention, not just tailored intervention. And I think it's going to be effective only when it is done, when it's intended to do. And I think it depends on what kind of information are we relying on. And I think it goes to the same issue as Dr. Dan talked about, the communication. When we apply these measures to a specific population, not just geographically. If it's geographically, it's going to be a lot easier than when we apply to a sort of cultural subpopulation. when the boundary is defined by different, behavior, different activities. And this is a problem. And when we do this, we need to understand what population, what kind of culture are we talking about, how we can communicate with this so we can maximize the effect of it. And I think that's the issue.
Right. Dr. Dan, very briefly, my final question to you. We talked about this earlier in the week. We talked about, actually, as a visible proof of what you had mentioned about the owners of sub-clubs here taking great action to prevent outbreaks. A number of them in the capital Seoul have decided to close doors ahead of the Halloween celebrations. What more can the public do for its part to ensure safety?
Right. I think people, they remember what happened in Itaewon because that whole cluster started at a club. And so that's really been the rallying cry, is remember Itaewon. We don't want to go through the same testing and isolation and all of the effort that had to go on then. So the public, they can make sure that the venue that they're going to is complying with all of the infectious disease core guidelines. If it looks like there are people standing there without a mask on, that's not the place to go. If it looks like it's too crowded, don't go in. And so people need to take personal responsibility now because you can't just rely on the club owners or the organizations, the facilities. Right. You need to take personal responsibility and decide if it doesn't look safe, then just stay away.
Right. All right, Dr. Dan, as always, thank you for your thoughts. And Professor Tak, thank you for being with us today.
Thank you for having me.
Right, and that is all the time we have for today's coverage of COVID-19. Tomorrow, as we keep saying, is Halloween, and authorities are urging members of the public here to abide by social distancing and the wearing of face masks to allow for a safe celebration this year amid the pandemic. Thank you for watching.